Good evening, everyone. It's such a pleasure to see so many familiar faces and to have you all here with us tonight. For those of you who I've not met, my name is Francesca Ogiman-White and I'm the founder of the Beauty Triangle. So some of you will be familiar with us already, and you might know that the past few talks we've done have all been about health. So we've studied mental health and the effect that that has on our self-esteem. And most recently we've done women's health as well, and we've spoken about how to manage hormones as well as the menopause. And the reason we've got this real focus on health right now is because I think all of us now appreciate that over the past 2 years or so, our health has really become our most precious commodity. You know, our bodies are these incredible machines and they really keep us functioning every single day, yet we so often take them for granted. Our aim at the Beauty Triangle has always been to educate and empower consumers on all aspects of their health and well-being, and always from a holistic standpoint. But it's also been to connect you with the very best voices in the health and well-being industry, which brings me to our fabulous lineup of ladies who we have with us tonight, starting with Dr. Sophie Shotter, who is founder of Illuminate Skin Clinic down in Kent. She's an amazing skin expert and aesthetic doctor. Next to Ms. Rachna Murthy, who is an ophthalmologist and oculoplastic surgeon. That was quite a mouthful, I'm impressed I said that. And she also has a residency here at Lanserhof at the Arts Club. And you may notice that our third and final speaker isn't Professor Mark Whiteley, who sadly couldn't be here tonight. He had a family emergency and he did apologise. But at the 11th hour, we were joined by Dr. Ursula Levine, who is the most fantastic integrative health specialist, and she is also the medical director here at Lanserhof at the Arts Club. And this fabulous panel are going to be talking to us tonight all about the new face of health. So everything from the really high-tech treatments to optimise our skin, our faces and our bodies, to the really innovative holistic routes that they are taking to make these treatments relevant to us today. I'm going to hand over to our speakers to say a very quick hello, but before that, I just want to draw your attention to programmes on your seats and also referral cards. So you'll find information about our speakers, and if you'd like us to connect you with anyone that you hear speak this evening, then just leave your name and email, tick a box, and we'll do the rest. What else? We'll have a Q&A at the very end, so if you have any burning questions, please save them until then. And you also have an incredible goodie bag to take away with you. We've got some great skincare in there from Revision Skincare, Dr. Seabag, Purifies and Eyes of the Story, as well as an amazing, very cool cryotherapy voucher for you to come back to Lanserhof at the Arts Club and use. So do not leave any of that behind because it's a real treat. That's enough from me. God, my necklace is really loud when I do that. I'm going to pass over to Sophie to say a quick hello, and then we'll get started with the rest of the conversation.
Thank you for the lovely introduction. My name's Dr. Sophie Shotter. So as Francesca said, I have a clinic in Kent and I also practice in Harley Street. My real passion is for looking great, feeling great. So very much about inner-outer overlap and for combining beautiful skin with great injectables. So that's what I spend most of my day doing.
Thank you, Sophie. Rachna, over to you.
So hello, welcome. Thank you for coming to the Lanserhof. As you heard from Francesca already, I'm an oculoplastic surgeon and ophthalmologist. That means that I look after eyes, and that's surgical, as well as non-surgical periocular treatments and skin. And we'll talk a little bit about the eye area today, so feel free to ask all the questions you want to ask. It's an area that we're all focused on at the moment, and that's why I'm here today. Thank you for the invitation. And looking forward to having a good discussion with all of you later on.
Thanks, Rachna.
Good evening, my name is Ursula Levine. I'm not the medical director at Lanserhof at the Arts Club, I'm an integrative GP, so I've...
So close. Sorry, I was bound to get you wrong, you were so last minute.
No worries. Thank you for having me again, and when you contacted me, or when I was contacted this afternoon, in midst of all my patients, I thought, I am to talk about beauty. And then, oh no, I talk about health, right? Which I will do. So I approach health from different angles that I'm going to explain, and I'm happy that you're all here and looking forward to the evening. Thanks.
Thank you so much, Ursula. So an amazing panel that we have here tonight. We're going to get cracking with some questions for Sophie first and foremost, who, as she has just explained, founder of Illuminate Skin Clinic and an absolute skincare expert. So do get all of your skincare questions ready for her. But Sophie, going back over the past year or two, COVID, everything, do you think that we're starting to see the effect of that stress in our skin now?
Yeah, very much. I think it's been all over the press. Everyone's been talking about how the Zoom boom, Zoom face. We've all become much more conscious of our appearance and things we don't like. And at first I thought it simply was Zoom, that we were just looking at ourselves more.
And picking at ourselves more.
Exactly, being really critical. But actually, as time's progressed, I've seen people coming to me who say, I really was genuinely happy with how I looked until this last sort of year, and now I feel like my neck has aged 10 years in 1 year. This real acceleration of aging. And I've always felt we age in spurts, like we grow in spurts as teenagers, we age in spurts as well. And I think there's been this massive communal stress that has led to many of us having aging spurts over the last 18 months, periods where we've felt that stress is shown on our faces and our bodies.
And it's so true, because actually people can experience a bereavement, or they can experience, you know, a really traumatic illness, and that can really age you significantly. So I think it stands to reason that, you know, something like lockdowns, COVID, that we've all been through collectively is going to have that
absolutely
effect.
And over the years, it's been very typical. Many of my patients have sought me out after a big stressful event, divorce, bereavement, menopause is another one, a stress on a woman's life, a big career change. All of these things have been things that bring people to our doors, but now I think it's just been this big acceleration that many of us have felt.
I 100% agree. And I think emotional stress is obviously one thing, but what about the sort of environmental stress that we're sort of so much more tuned into now? I mean, we have sunlight, which I think we're all starting to slowly get a bit better at, you know, SPF, understanding the effects of UVA, UVB rays on the skin, but what about things like pollution and urban dust and all these terrifying words that are thrown at us all the time?
Yeah, huge impact. And I think many of us have really, again, noticed that through COVID. So many migrated out of London, so many spent more time in nature, less time in the city, and now we've all come back into it. We've really noticed that affecting our skin as well. And we've all talked about sunlight for a good few years now. A lot of people in the room will probably know that vitamin C is really, really great for protecting you from sunlight with a sunscreen. But what we don't know is that actually that is pretty much where vitamin C's protective benefits end, and actually we need other antioxidants and other protective factors in our skincare if we want to protect against pollution.
Yeah. What are the things that you're sort of recommending to your patients now to protect them from things like pollution? Because it is everywhere, particularly in a place like London.
Exactly.
I think Oxford Street is the most polluted street in practically the world, I heard.
Yeah, it goes between
terrifies
Euston Road, I think, the Marylebone Road, and Oxford Street, one or the other all the time.
It's horrifying.
Yeah, so one thing I always say, if you're working, living in the city, at the end of the day, do a double cleanse. That's one thing. Get that pollution out of your pores. Preferably not with a cleansing brush, because actually a lot of them will drive the pollution deeper into your skin rather than lifting it out.
Those are things like the manual clarisonics.
Exactly.
Sort of the ones that oscillate and vibrate.
Exactly. So just a really good double cleanse. And then looking for broad spectrum antioxidants. Now, that's not to say vitamin C isn't great. It's great. But it's also historically, there are very few products that can formulate it together with other antioxidants just because of how fragile it is. So think about incorporating other antioxidants into your regime. Look at products that contain other antioxidants because it doesn't all end at vitamin C. So polyphenols, things like that.
Are there any serums or moisturisers or cleansers that you're sort of really rating and that you can talk about? Because it's always useful to know what to actually go out and buy.
I guess antioxidant-wise for me, the most comprehensive one I've ever found is by Skin Better Science, which is the Alto Defense Serum, and it's got 19 different antioxidants, including vitamin C. And so me having said it's difficult to formulate with that and others, that's an exception.
Skin Better Science, I love. They do an amazing retinol as well.
They do, yeah. That and Revision for me are kind of, and I mean, there's several that I adore at the moment. I do love skincare. I'm a geek. And cleanser-wise, I'm actually really liking a new one called DeloRx, which was developed by a dermatologist friend of mine, Stephanie Williams, and it's really lovely. It's formulated actually for oilier skin types that also have aging concerns, but I don't have oily skin and it's perfect on my skin. And I just find it really lifts off. My skin feels so clean, but also not tight and dehydrated afterwards.
So do you still double cleanse with that? Would you put something before or after that one?
I usually actually use micellar water first. So for me, the Bioderma one or the Bio Effects, I like both of those. They're nice and light and unfragranced, and there's no astringents to them. So one of those first, and then I'll do a really good thorough sort of 2-minute cleanse.
Yes, perfect.
With my Dermalux.
And so pollution aside, I mean, I think the other thing that's obviously very detrimental is, things like, the digital devices that we're spending all our time on. And I think social media is so well documented for the effect it has on our mental health. But what about the physical effects of spending so much time on our phone? We always hear about blue light. Is that something really to be worried about, or is it, not sort of on a scale of pollution and UV?
It is definitely something to be aware of. It's coming out, as you said, every device we're looking at all the time. We're spending so much more time, but it's also in daylight. So, and this is why everyone says, I don't need to wear a sunscreen. I've been indoors all day.
Or yes, it's not sunny in the UK.
Exactly.
Which it is.
Every single day, unless you need a torch to see outside, you should be wearing a sunscreen with at least an SPF of 30 or equivalent. So, if it's sunny, if you're on holiday, if it's the summer in the UK, factor 50. But the rest of the time at least a 30.
There's a Heliocare one that I use, sorry to interrupt, which has a filter against blue light. Yes. Do you use that one?
So that's one of my go-tos. Institute Estherderm also have a really nice one.
Yeah.
But iron oxide, it's hard to read an ingredients list, and unless a product specifically says blue light protective, then you also need to be looking, it's hard to read an ingredients list unless you know what you're looking for. But iron oxide is a good one to look for as a blue light filter.
Iron oxide, because that's a physical barrier on the skin then against the blue light, isn't it?
But what blue light won't do is cause skin cancer. But what it will do is cause really deep-seated hyperpigmentation and aging concern. So it penetrates deeper than UVA even. But it doesn't carry the skin cancer risk.
And it's interesting because I think a lot of us have only just started to see, maybe we did a lot of sunbathing as teenagers and we put oil on our faces, or maybe that was just me. And then when you hit your 30s or your 40s, that's when you see the pigmentation. And I suspect the same sort of thing may happen with blue light. It's a very small dose, but it's very cumulative, and it will build up.
Exactly. And another thing I've done, because, at first people developed these blue light filter glasses, which are brilliant because blue light also has a very harmful effect on the eyes. But for me, it's about remembering to put them on all the time. Am I going to put them on every time I pick my phone up? So all of my devices, no way. All of my devices have these blue light filters stuck on the screen by a brand called OcuShield.
Okay.
And they do make it so if I try and show a patient in a consultation, my screen has to be at a very specific angle for them to see anything. But they're brilliant, and I don't even need to think about it.
Yeah, exactly. It's just automatic. Moving a bit more into injectables, because you're a real sort of expert in that arena. I feel like a lot of the injectables we're looking at now, things like skin boosters, which some of you may or may not be sort of familiar with, are really targeting skin health in a big way. That previously we've spoken about injectables as a way to volumize the skin or to modulate muscle movement. But what do you think is driving this sort of trend for skin boosters, and what are you using yourself in clinic?
I think part of it is social media and is this kind of presentation of flawless, perfect skin that everyone wants. But that does represent health. So fair enough, a lot of what we're seeing on social media might be filtered, but actually having nice, bright, clear, radiant, healthy skin is a representation of what's going on the inside as well.
So true.
So people are looking to have that glow.
And at any age and sex as well, it's not just a thing reserved purely for women. I think men want this as well, right?
They do, definitely. And I use, to be honest, there's not many I haven't tried at some point, but the main ones I use in my armoury are Profilo, which I love.
Profilo is the one that's sort of 5 points on each side of the face, isn't it?
Yes. So it's a hyaluronic acid, which is the same hyaluronic acid as you'll have in your skincare, but it's made in a way it's very pure, and it will stay in your skin for about 20 to 30 days and switch back on collagen and elastin production. So it's very clever. And that's one of my go-tos. Juvederm Volite I like because it's like an injectable sponge. It stays there and it holds moisture in the skin. And then the latest one I've been using as well is a product called Nucleophil. And the reason that's in my armoury is they have a product that does this around the eye. So obviously the eye's a difficult area, and there's many things you won't want to inject near it. And Profilo is one of them because it's far too water retaining and it can make you puffy. Whereas
and if you have puffiness already, it's the last thing you want to be using.
Exactly. So Nucleophil is based on polynucleotides. So nucleotides are the basis of our DNA, and it's a different concept, but works beautifully.
So is that also stimulating collagen and elastin? It's just using different ingredients to do it?
Exactly, and a slightly different treatment regime as well.
Yeah. So how often, like with nucleophil, for example, how often are you having that treatment and how long do the effects last?
Nucleophil is 2 sessions for most people, done 2 weeks apart. Profilo is 2 sessions done about 4 weeks apart. Profilo, I would tend to advocate having 2 sessions 6 monthly. Nucleophil, I haven't been using long enough to say that for sure, but from colleagues also in other countries who've been using it, anecdotally a year, so longer lasting.
And these are all delivered with needles or with like a cannula that goes under the skin?
The nucleophil I use mainly cannula for, and the Profilo mainly needles.
Okay.
It's all to do with what layer you want it in. The nucleophil, you're actually trying to stimulate tissue, deeper tissue as well, whereas the Profilo is very much about skin.
Agreed. And so you just spoke about collagen but also elastin, and I feel like the conversation on collagen has become very big. I think we all are familiar with that term, so we don't probably need to go into it as much, but why is elastin so important to, have healthy skin in the long run?
So collagen is the most abundant protein in our body. It's the framework protein that gives structure to our skin, our cartilage. We have it everywhere. But elastin, so where collagen gives framework, elastin gives bounce. So youthful skin is firm and bouncy. And so they're both really important. And historically, people haven't really measured the elastin stimulation. But actually, you need both to have good, healthy skin, and hyaluronic acid as well.
Okay, so how do we go about, what treatments have you got aside from the skin boosters that are really going to stimulate the elastin? Because I think that's obviously something we need to up the ante on.
So the one that for me, part of what made me drawn to the device was exactly this. It's a device called Profound. So it combines microneedling and radio frequency. And lots of you in the room have probably heard of Morpheus 8, which everyone's been talking about
because of Judy Murray's dramatic oval.
Yes.
She does look amazing.
She does.
But I don't think it was just Morpheus 8 she had.
Combination of several things.
Yes.
Including
some injectables, which no one talks about.
And skincare, all of it in there. But the Profound is a bit more intense than Morpheus 8. It works to the same depth, but for a much longer duration. So it's a one treatment protocol, and you have downtime with it. But the results, they've measured the elastin stimulation, and it's a 5-fold increase in elastin and a doubling in collagen. So it's really giving your skin. The first thing people tend to notice is this kind of that their skin really feels different. It feels younger, not just firmer.
Sort of thicker somehow.
Yeah.
Yeah.
And then the studies again have shown that the lift is equivalent to a third of a surgical facelift.
That is amazing.
Which is remarkable.
Does that mean it's suitable for what sort of age group? Is it a slightly older patient, or can anyone sort of benefit from the general elastin collagen production at any age?
Everyone can benefit from it, but I would say there's probably going to be very few people definitely under 40, probably under 45, who I'm going to say, yes, the downtime for you is worth it. Usually in that age group, I'll point people towards something like Softwave, which is non-invasive.
And what's Softwave? This is another new treatment.
Yeah, Softwave is new to the UK, but is established in the US, and it's FDA cleared for lifting and tightening, which is very unusual. Not many devices have that, and it uses ultrasound, but in a different way to other devices on the market. And the lift and results with it that I've seen have been really impressive. So it's a device we're literally just in the middle of launching, but has no downtime, very minimal discomfort. You can have it, you can go out for dinner that night, you can put your makeup on straight afterwards, and people see results even at a month, but proper results around 3 months.
Because it sounds very similar to old therapy, which is also using focused ultrasound, which I have had, and I must say that's kind of excruciating. So is this better?
Yes. So it is different to old therapy in that it's not focused ultrasound. It delivers more energy, and it also doesn't deliver it into the deeper layers of the face. So having worked closely with plastic surgeons, one of the treatments they always said, did you really have to recommend that was old therapy?
Why is that?
Because it targets the SMAS, which is the deeper layer of the face, and then when a surgeon wants to do a facelift and they try and dissect down, it's very stuck together and makes it difficult to do. So I liked it. It was a good treatment, but the surgeons didn't like me much for recommending it. So the Softwave works more superficially, which at first glance I thought, is that going to give the results? But it really does, just through a different use of, it's like the original iPhone versus an iPhone 13.
Yeah.
But comfort-wise, I had it on Thursday. A huge amount of the pulses of energy I didn't feel at all with good numbing cream on. And then every now and then I'd get one that for 2 out of 5 seconds I felt. But really very, very easy.
Okay, I want to come in and have this with you as well.
Anytime.
Very good for like a lower face, isn't it? For
exactly.
the jawline.
And actually also for brows. The lift on the brows that they're getting on the studies is sort of 3 to 4 millimeters. So impressive.
Really? Wow.
And you can pull up the lid skin and the lower lid skin as well.
I mean, we'll come to Rachna to talk about the effects of an actual surgical lid lift, but I mean, that sounds like a really nice little, before you go and see Rachna.
I always tell my patients there is no treatment for the lids that comes close to surgery.
Yeah.
And Rachna knows this because I send her most of my blasts. Well, if they come into London, they all come to her. So I always say with patients, if you are a candidate for that, that will give you the best results with much less downtime than you expected to.
Amazing. And final question before we move on to talk more about eyes and eye surgery. What about the sort of effect of combining all these treatments? So you've mentioned lots of energy-based sort of delivery systems, ultrasound, radio frequency, microneedling. How does that sort of really up the ante when it comes to combinations? What are you then throwing into the mix to, enhance skin health long term?
I mean, the magic for me is in combining different treatments, because aging happens on every level, and it's not just collagen loss. It's not just the fact that we lose volume in our face. It's not just the fact that our cell turnover, it's everything. So the magic is in having a great home care regime. That's like doing your regular exercise program, and then when you come into clinic to see us, it's like your PT sessions. And addressing the volume loss with fillers, the structural changes in the face, addressing the skin health with a combination of boosters and technology-based treatments. That's where you'll get best results long term, is by working on every level.
Exactly, and I think long-term skin health is the goal. We don't just want it today, we want it into the long run.
Yeah.
Thank you so much. It was really interesting. I learned so much from you this evening. I always do. So thank you, Sophie. And moving to our brilliant oculoplastic surgeon and ophthalmologist. I'm getting really good at that now. Thank you so much for being with us, Rachna. As Rachna explained, she works here at Lanserhof. She is one of the co-founders of Face Restoration. So she has a very holistic approach to medical eye health, but also aesthetic eye health. So maybe, Rachna, you can sort of start by saying, are most people coming to see you for the functional eye health, or is it more the cosmetic eye concerns that bring people to your door?
It's a combination. I think that we've always been very focused on the eye area anyway.
Yeah.
From way back. There are good studies that have been done by a Russian scientist called Alfred Yarbus in the 60s. And basically, when we communicate with each other, we always start by looking at someone's eyes. So if you're looking at each other, you're looking at me, you're looking at my eyes, and then you might look at my nose, my mouth, and you'll scan my face and notice any scars or any...
It's the beauty triangle, that's what they call it.
Any signatures that a surgeon might have left on your face inadvertently, and then head back to the eyes again. So the eyes are a really important area that we've always been focused on.
And particularly now, I guess.
Particularly now, and we've been staring at our eyes with zooms and our necks as well, but not the eye area. And in fact, there are not many men in the audience, but I think for the first time, men have been staring at their faces over the last year and have been aware of their eye area. So we've had a huge, and I honestly, Jonathan Bruce, who's sitting in the audience as well, is my business partner, and we work together, and we'll explain about why that we work together later on. But we have seen a huge influx of people with cosmetic concerns, not just functional concerns. I was an NHS consultant for 15 years, dealing mainly with functional disease around the eyes in Cambridge and Addenbrooke's. And a lot of the concerns from the patients that I saw with functional disease were relating to aesthetics as well. So this area is very important. A little change in the appearance of the eyes can turn someone from looking really sad to very happy, and vice versa. So anything that I do to the eye area can make someone look sad or angry if I don't
so
get it
right.
quite right. So it's a very important area.
And it's true, because actually it's the first area that for most of us we start to notice those early signs of age. You know, it might be fine lines, it might be bags, it might be pigmentation, but like you say as well, it's when those physical, we don't always mind seeing physical changes. You know, you don't necessarily mind a little bit of, you know, freckling, pigmentation, some fine lines on your forehead, but I think it's when they start to have emotional attributes and they start to make you look a way that you don't feel inside, that it becomes problematic.
Sophie was telling us all about the injectables and the facial skincare, but this area has to be dealt with slightly differently. The skin in this area is the thinnest skin in the body, so it's less than 0.5 millimeter in some places. So the rest of the face is over 1 millimeter. We don't have any fat directly underneath that skin, so you can see the muscle directly underneath, and you can see the blood vessels directly underneath. And we start aging from our 20s, so we're talking a little bit about collagen. The collagen starts to head down steadily from our 20s. And as a woman, we suddenly hit menopause and it suddenly goes down.
Falls off a cliff.
As a man, that it's a gradual decline. But those changes will happen in the eye area first, because we've got lots of muscles right underneath the skin. We've got 7 different muscle groups in each side, working and contracting together and relaxing together. And so if you imagine, our skin is like a flexible sheet on the muscles when we're very young, and then the muscles are contracting underneath it, and then we lose collagen from the skin. And those muscles still carry on contracting, so we all have expression, we make these expressions.
And constant blinking as well, I imagine.
Blinking, protecting the eye with the blink, moving the tears from the tear gland to the tear duct every time we blink. All of that adds to the fact that we will develop some lines when we lose the collagen in the skin. And we get the lines forming in the frown area first. And if we have a little bit of difficulty in our vision, so we're short-sighted or long-sighted, we might strain to read, and we might strain at zooms for the last year. So these lines would have become more noticeable. These laughter lines would have become more noticeable, not necessarily because we're laughing a lot for the last year, the crow's feet. But yes, it's an area that shows the changes very early on, and those changes happen also because everything starts to sag and descend. So in our faces, the cheek fat pads here start to descend, and then you can see the hollow of the eye socket. There's a bone underneath that called the orbital rim, or the orbital circumference around the eyeball, and then you start to see that orbit. And so a lot of the things that we are seeing in our clinic relate to the aesthetic changes that are happening in this area first, and have really been accelerated over the last 18 months.
But you're so right as well, because you know it's not just the upper third or the eye area, it's where it hits the cheek junction. It's the entire face that can then you know exacerbate that appearance. What sort of, before we get onto the surgical stuff, what are the sort of non-surgical approaches that you have to the eye? What are the things that sort of bother people most when it comes to that area?
It's a great question, because we're talking about holistic meets high tech here, and you know, when we're talking about holistic care, we can't just be dealing with the eyes, or we can't just be dealing with the face, or just doing injectables. It's all about, as Sophie said, having a combination of treatments. You're dealing with skin, and we should be thinking about doing everything that's appropriate, using all the, as a practitioner, I should be able to provide all the tools available at my fingertips, and be able to choose what the right thing is for the individual. So it's a combination of skincare. You've got little packages of revision line relaxer in your goodie bag, which you'll see later
Which
on.
I love. It's got such a nice cold metal applicator as well.
Which is wonderful, because for the first time we're able to enhance our toxin treatments around the periocular area, so Botox will last longer. It will also improve the neurotransmission and reduction of this substance called acetylcholine, which is what happens in the muscles when they contract, but it also is released in the skin. So the topical skincare can improve the skin quality as well as the lines and wrinkles, not just by hydrating, but also by acting on the muscles underneath, and by also improving the sebum secretions in the skin. So that's a skincare. Then we talked about injectables, so all the injectables that we use around the face, and Sophie was talking about skin boosters. You wouldn't use those so close to the eye because the skin is so thin in that area, but there are appropriate injectables to be using near the eye. I also use Juvederm products, both on the faculty for Allergan, that makes that the Juvederm range and has the longest safety record, and it's a very good product used in the right hands.
Agreed.
But it's all about the layers and addressing the needs and knowing what the changes are that have happened to cause those appearance changes. So dark circles and the baggy eyelids are a combination of skin and sagging fat pads, thinning skin, and also dehiscence or breakdown of this little sheet in the eyelid called the septum, which is what holds the fat back.
And when you start to see the puffiness or the bagging, it's because that's become loose, right?
And so that's become stretched and the fat's bulging forward. And if I went and treated everybody with an injectable for that, they wouldn't all have an improvement in their appearance. If there's thinning of that sheet, then that's when surgery needs to be thought about rather than injecting around the area. But not everybody has to have surgery, so there are options. There are options of having skincare that can improve the dark circles and the contours. There are options of having injectables in the right places around the eye area that can improve the appearance and lift the cheek and reduce the lines as well.
It's a more holistic approach that you're taking.
It's a holistic approach, and then there are energy devices. There are some energy devices that can be particularly nasty around the eyelid area. I would advocate that anybody thinking of treatments around the eye area see a specialist who has dealt with the eye area for a long time. Sophie does. I do, and
you need to see the right person.
Need to see the
who
right
has
person.
the experience.
Don't go and have the cheapest option or the first option. So do your research and make sure you've spoken to a few different people who know what they're doing.
Agreed.
Before you go and burn your skin to try and reduce the baggy eyelids.
God, yeah,
because
definitely
that may
don't do
well
that.
end up causing more problems down the line.
I mean, all of these aesthetic concerns aside, what are the functional things that are bringing people to your door? Is it things like dry eyes, sort of rubbing the eyes?
Yeah.
I mean, I'm guilty of all of these.
So dry eyes are incredibly common. Like 80%, there's some statistic that about 80% of people will have some degree of dry eye during some part of their life. I mean, we've all had to rub our eyes, and particularly wearing masks a lot.
And staring at screens as well.
Staring
I
at
hear that just
screens.
the focus is what stops
so
the blinking.
you're not when you're trying to focus on something for a long time, you're going to be not blinking as much, and the blinking is basically like the windshield, the wipers to your windshield, the cornea of the eye.
Oh, I love
So
that expression.
every time you blink, you basically wipe the washer, which is your tears, all over the front surface of the eye. But when you're trying to focus on something, you're not going to blink as much, so those tears evaporate, and then you end up with these dry eyes, and that is a temporary thing. But if you keep doing that long term, then you can get damage to the surface of the eye, and you can end up with some persistent dry eyes. But there are a lot of other things that we do. So you talked a little bit about environmental pollutants, but we all most of us wear makeup on our eyes, and a lot of the makeup that we have has got toxins in it, and we wouldn't know about it unless you're in an environment here like this and we're talking about these things. But formaldehyde has been in mascara and in shampoos and lots of other things for a long time as a preservative.
So what's that doing? Sort of causing very
It's a
low levels of
preservative.
inflammation
It's a
to the eye.
preservative that's actually cytotoxic. So if you
What does cytotoxic mean?
So that basically is damaging the cells, so toxic to the cells, cyto cells. And the cells of the front surface of the eye, if you damage them, then you will end up with dryness and will end up with chronic damage and dryness. Mascaras have to have a degree of preservative, but how do we avoid toxins around our eyes? We use makeup that is either changed very regularly, so you're not going to be leaving it on your eyelashes at night time, and you're going to take your makeup off, and you're going to discard your bottle after a few months, as they suggest that you should do, because you've got bacteria growing in there. But you have to have some preservative, because you don't want bacteria to be growing in your mascara when you put it on your eyelashes. So one of the products you've also got in your goodie bag is something called Purifies, and that's something that we developed with a company that makes a very high purity hypochlorous acid that is a antimicrobial spray. So for the first time, we're able to spray something directly on the eyelids and the eyes and contact lenses and eyelashes and lash extensions that will be able to get rid of the overgrowth of bacteria. May well be able to use it on mascara once, but I think you'll probably run out of mascara very quickly.
It's really nice. You gave me a bottle a while ago. It's very refreshing, and you just spritz it and you sort of blink your eyes, opening it to get it onto the eyeball.
It's meant to be safe on the eye, but sometimes it can sting a little. But it's great for protecting what we call the microbiome,
which I feel like we always speak about in the skin, but I've never really spoken about it when it comes to the eyes.
Exactly. And if we're going for holistic, we have a huge organ, the gut, which has the gut microbiome that protects us from all sorts of things, so autoimmune diseases, cancers, and lots of things we can develop because we have a breakdown of the microbiome. And so we're thinking a lot about probiotics and prebiotics and postbiotics to try and protect our gut microbiome, but the skin is the biggest organ in the body, and that includes the eyelid skin and the eyelashes, and then we have bacteria all over our skin that are good bacteria. But wearing masks, blowing bacteria all over our eyelids and eyelashes, staring at the BDUs and not blinking enough, you will get more bacteria, and we have to think about resetting the microbiome, and that's where that product comes in.
Can all of these functional issues eventually manifest in a more aesthetic condition? Like if I'm constantly rubbing my eyes and not blinking enough and they're very dry, does that mean in later life I'll have sort of more noticeable skin laxity and then I'll need to come and see you for a lid lift?
Yes, to a degree. I mean, there are functional conditions that are the extreme, where there are lots of rubbing, and patients will end up with something called floppy eyelids and floppy eyelid syndrome, where there are very saggy, droopy lids. But it's one thing we check for as a functional eye doctor. If someone has got a droopy eyelid, we will check to see whether it is caused from rubbing and floppy lids, or whether it's due to a nerve problem, or whether it's due to a mechanical weight problem from pulling of the skin. And so it's important that we assess every sort of functional condition for other medical causes, but also treat the functional condition to improve the aesthetic as well. So
exactly. I feel like the two just go very naturally
they have to go hand in hand.
And so obviously blepharoplasties, by which I mean the upper lid lift or the lower lid surgery, are sort of your bread and butter, aren't they? Can you sort of explain a little bit about what you do to enhance the appearance of the eyes through those surgeries, you and Professor Roos together?
Yeah, so I mean, we have basically, it is our bread and butter, but there are lots of people doing this type of surgery, and we are on multiple societies. We are members of there's a handful of people in this country who are actually members of the British, American, European oculoplastic surgical societies, and we regularly speak at these meetings, and we learn from others across the pond and around Europe and in Asia, and we pick up little tricks and tips, and we also teach as well. And so we're constantly striving to improve what we do, and our holy grail, I would say, is to have the least invasive treatment for our patients. Even with surgery, something that's the least invasive to give the best outcome. And with eyelid surgery, we have finally honed, I think at this point, we've finally honed our techniques to be able to make the downtime minimal for people, so that it is almost verging on what
non-surgical.
To use the term that some people might have heard of, a treatment.
What are you doing exactly to reduce the trauma and the bruising?
That's a secret. Well, seriously, we have trademarked the scarsless approach because there are a number of things that we do. So it's not just one thing. It's a cocktail of different drugs, and when I say cocktail, you're not given a cocktail, and I'm not having lots
probably
of drugs.
Probably have quite a nice effect though, calm you down before the surgery.
Exactly, so that's one of the things. So it's all about communication. I mean, our mission is to, what do we have? Listen, care, cure and restore. And it's all about communication, looking after our patients as if they are family or friend. At every point in the patient journey, there is full transparency. We do a Zoom call beforehand once patients have decided to go ahead with surgery, and have had all the paperwork, they've already had their consultation, they know exactly what to expect on the day, so they're completely relaxed when they come to the appointment for the surgery.
Yeah.
We have music, we have aromatherapy, there are lots of
Sounds like a spa.
Yeah, it is exactly a spa experience.
Surgery and
and
a
there
spa.
are lots of non-surgical things that can make the surgical outcome better, and it's not just being a technician and being able to cut and sew.
Yeah, exactly. Although you were very good at that as well. That's
that
the main reason
helps.
we're coming to see you.
It helps, yeah. I mean, we do leave our signatures on people's faces, so it's important that we don't leave a signature that's visible. So, it's
And are you doing these procedures under a local anaesthetic?
Yeah, I mean, most of our colleagues actually do put people to sleep, and there will be some people who don't want to be awake for these things, but you don't absolutely have to be awake at all. I would say that this is far less of a traumatic experience than having some injectables done. So.
Also, I think some people are very scared of a general, and you can't underestimate that, so you have to have alternatives for people nowadays.
I wouldn't personally, if I was having an operation like this, want to be put to sleep with a tube. And my husband's an anaesthetist, so I'm not putting anaesthetists down. Again, they play a very, really important role to keep people alive during surgery, but this is not something that needs a general anaesthetic. We do virtually 99% of our surgery under local anaesthetic.
And what's the average age of patient who comes to see you for these sort of upper lid and lower lift surgeries?
If it's a functional cause, there might be a child with a droopy lid, for instance.
Yeah, fair enough.
And in which case it would be a general anaesthetic. But everybody ages differently. It depends on the genetics. It depends on underlying sort of, history of medical conditions. Probably in women, they tend to come a little bit earlier than men. Men actually have lower brows and have more hooded skin and do have these changes earlier than women, but I think they tend to hang on. And it's quite nice to have that rugged look, really, perhaps.
Yeah.
But women around the age of sort of late 30s upwards will come for surgery, for surgical correction, and a lot more now. This has really been the huge increase in
the era of the blepharoplasty.
Requests in this area at this time.
And finally, you mentioned that you obviously work very closely with Professor Russo, who is your co-founder at Face Restoration. How does that work? Because it's very unusual for surgeons to work together in sort of a partnership, isn't it?
I don't think there's any two plastic surgeons that work together as a team. I mean, first of all, for the patient, this is very much patient focused. So for the patient, diverse teams have better outcomes. There are two people who are consultant level experts looking after an individual. There's always somebody focused directly on what they're doing and another focused on communication and listening.
That's so nice. That's such a modern way to do the surgery.
If all surgeons could get rid of the ego, I think there is a lot of ego in surgery. If they could get rid of the ego and work as teams, then I think that will be the future of looking after a patient. We certainly have extremely good reviews from our patients, not just with the surgical outcome, but for the whole experience. And they've all said that actually it's very refreshing to have two people.
Agreed.
Working as one, caring for them.
No, I can totally appreciate that. When I come to have my eyes done, which will be very soon, I'll be coming to you guys. Thank you so much, Rachna. That was really, really interesting.
Pleasure. Thank you very much.
Our third and final speaker, Dr. Levine, our 11th hour entrant. As she explained to everyone here, she is Lanserhof's Integrative Health Specialist, not medical director, got it right this time. And she can answer any questions you have about the Lanserhof concept. But Ursula, maybe you can start by talking a little bit about how the past 2 years of COVID have changed our perception of our health.
Well, I think I can honestly say, and I think you all would agree, that COVID has traumatized us all on many, many different aspects. And I've mentioned that in the talk before. For me, health is based on 5 principles. So as an integrative or holistic medical doctor, I look at the physical aspect, and we all can agree that COVID has a physical aspect and an input on us. If we had COVID, if we had the vaccine, if we had side effects, it is in our heads that, people are really, really sick, people are still dying, and we are all very lucky sitting in this room without a mask you know, in where
True.
where I come from, there is a lockdown from today because people are dying in the hospital corridors because they can't get treated, because there's still many people who are not vaccinated, who are not looking after themselves, still suffering from COVID.
Yeah.
So the physical aspect of COVID is immense, and even if we don't want to see it, and I'm sort of flippantly wearing this mask.
But it's very stylish because you've got it attached to your nice beaded necklace.
But we still have to be mindful, and we still have to be careful. So I appreciate that we say these past 18 months, but it's still ongoing.
Has it changed the patients that you see? Has it changed how they approach their health, do you think?
Absolutely.
Yeah.
And for the first time I've been a medical doctor for more than 30 years. I see more male patients now than I had ever before.
That's
because in this course of global crisis, men can admit that there is something wrong, and
whereas
they
previously
suffer.
they wouldn't have come to your door, they would have suffered in silence.
They were always dragged in by their wives, sort of thing, to see a holistic doctor. But now that has changed, and that is I think this is very, very important. So the physical aspects, I don't only look at what COVID does, but we look at the energetic part, and this is quite interesting why I feed then into health from the skin or for the eyes, because that's all linked to organs. So when someone has puffy eyes, I look at their diet.
Is that a branch of traditional Chinese medicine where you're connecting it all together?
Absolutely. So when the skin is puffy and the flesh becomes soggy, you can say that there is something wrong in the diet.
What does it tell you is wrong in the diet? What are you lacking if you have puffy eyes?
You don't lack, you have too much sugar.
That
too
makes
many
sense.
carbs.
Okay, this is me.
So too much processed food. So it's really the problem of what you lack. Well, with certain things, when we talk about minerals, amino acids, and such like. But when we talk about food as such, grosso modo, you can say we have too much.
It's probably excess in our world that we live in now, more than lack of something, isn't it?
And the eyes have a lot to do with the liver.
Really?
The eyes are the sensitive organ that is connected to the liver, so it has a lot to do with detox.
Yes, exactly.
So what you said before about the detox and the things that come in, the microtoxins, that has a lot to do with the eyes.
How interesting.
So that's the physical aspect.
Yes.
And then COVID had an impact on our emotional health. I mean, being locked down, losing your job, being physically ill, losing relatives, losing friends, not being in contact, had a big emotional impact.
Did you see that manifest in your patients' health? Were they more tired as a result, lethargic? Like, did their, body give up in some sort of a way because of that emotional deprivation?
For some people, really a vicious circle started, because, when you don't feel well physically, it has an impact on your emotions, and when you don't feel well emotionally, you don't want to move. Then
That's so true.
You sort of
you get stuck in that cycle.
You engage in more unhealthy lifestyles. So literally a vicious circle. My patients don't sleep well. And this the whole emotional range, and what COVID does as a virus is it literally, it's like lifting a thick carpet where you hit everything that you did bad in your life before, or it happened to you.
It brings out all of the weaknesses in your body, in a sense.
And also like old virus infections. So it's reactivating actually everything that happened in the past, and this is why it becomes so vicious, because it's not a one size fits all. It can affect us. The Chinese say we all are born with a weak link in our chain, and you can make sure that COVID finds that weak link, and whatever it is, it will find it and target it, and then you have the symptoms.
It will go straight to it. Tell us a little bit about how your approach at Lanserhof addresses these things. So you obviously are a huge believer in Maya medicine and activating a sort of alkaline state within the body to help heal across, a sort of holistic sense. Is that right? How does that sort of help us to be healthy in the long run?
So Rachna mentioned it a little bit before when she started talking about the microbiome.
Yes.
So a big aspect of our lives is our gut health. and as I said, it has a big impact of what we put in there. Yeah, nobody would put petrol in a diesel car.
That is true.
Yeah, so we look after our cars sometimes better than after our own body. Yeah, so what we look at in the LansMed concept that was developed from the basics of FX Maya, we talk about a targeted, tailor-made diagnostic medicine, where we, when a patient comes and tells us their story and their issues, we try to make sure that we find out exactly what the underlying issues are.
So you have to be a bit of an investigator and really sort of rummage around.
Absolutely, and sometimes my patients say, "Ooh, I've never been asked that before." Yeah.
What sort of questions are you asking them?
Well, we talk about sleep, we talk about a lot about food, we also talk about the sex life. Yeah.
Really? That's important?
Yeah.
Wow.
Absolutely.
Why?
Yeah. Because it helps the liver detox.
Sex helps the liver detox?
Yes.
That is really cool.
This is what I always say. The liver, for the detox...
I feel like everyone's writing that down.
Does not want...
Sorry.
Wants two things. Yeah. It's physical exercise and it's a healthy love life.
That's so nice.
Yeah, so choose one.
Yeah.
Yeah.
I mean, you could do both. Well, yeah. You could do both, no?
Yeah, of course you
Exercise
can.
and
Yeah,
sex,
but
and it'd be
sometimes,
great.
things are not possible. So you can choose one.
Okay.
Yeah. So, well, apart from that, sometimes I say when people, my patients are English, I say you have to leave the Englishness outside of the door because we talk about things that you normally wouldn't talk to.
Yes.
Yeah? The tailor-made diagnostics, which are extensive blood tests, we do genetic tests, so we look at the DNA from different angles, we look at certain aspects of the DNA that have to do with nutrition or with your diet, with your sports performance, with how well, and I find that very, very interesting, about how well you metabolize medication. Yeah.
Why is that sort of so relevant to the patients that you're working with?
Well, sometimes, especially my American patients, they get prescriptions, strong medication like candy, and then sometimes symptoms don't get better, and then they get more candies and green candies and red candies,
and suddenly you're hooked on all of these
exactly.
And medications.
And then I do this DNA test, and we find out, hang on, you can't metabolize that.
That's so interesting. So all of that stuff they've been putting into their body has been a waste of time.
Absolutely.
Because they didn't get to know their own body in a sense.
Yeah, and then I come with the machete, basically. Yeah.
Exactly.
The machete being a fasting program,
Okay, so fasting is obviously very key to this whole Lanserhof concept, and that's, I guess, getting the body to reset itself.
Absolutely, but it's not only the body resetting itself, it's the whole system. So when we talk about the physical, the emotional, the mental, and that's very important. The mental aspect of our health is where the healing starts, because we set us up for healing or for deteriorating. When you say to yourself, this is how I am, your brain gets the message, hang on, I'm not going to change, this is how she is. So this is about changing, and I will call myself the word police. It's very Germanic, but it goes down. So I say, listen to yourself. What are you saying about yourself when you say, okay, lockdown made me fat. Right. Okay, let's start there. What exactly?
It wasn't exactly lockdown.
What exactly
it was those 3 bottles
is going
of
on?
wine.
So we are sort of deconstructing that, And when you set yourself up, it's literally a killer phrase when you say, I need my chocolate. Right.
So we actually need to learn to be a bit stricter with ourselves, or a bit more, I don't know, honest.
It's probably honest, and I mean, I like the word discipline.
I thought you would.
So, but you get help with that, So this is where then the treatment starts,
Yeah, exactly.
And the first step would be like a fasting program.
And when you say fasting, do you mean intermittent fasting, sort of like a 16-hour window with no food and then having all your meals in an 8-hour, or do you mean actual no food?
So we would separate the two things. There are things that you do in-house or you take home. So the 16-8 would be something that you do at home.
Exactly.
Because you can do that from home. What we offer is in our resorts that you go there, and for a limited amount of time you are exposed to a very monotonous menu plus a very restrictive menu.
I've had this before. It's like broth for supper and it's a bread roll for breakfast and not much else in between.
And the protein source. Yeah?
Yes.
But the bread roll, as you might remember, has no nutritional value. The bread roll is actually very, very crucial in the sense of educating discipline, because the core element of our healing of our gut is to slow down. Yeah.
And so, you can't eat that roll quickly because it's so stale.
That's not even the point. See, this is where the word police comes in, because you can see it that way, but it's actually teaching you to chew. And
yes,
this is
agreed.
what we call it. It's called the chewing trainer. Yeah. Because when you chew, 3 things happen. Yeah. You produce saliva. When you gobble things down, you don't produce saliva. But believe it or not, the saliva is the cheapest prebiotic that exists, yeah, because it feeds the gut bacteria that protect the gut lining. So when you chew properly and you slow down, you protect your gut.
But you also get into a more mindful state as well, because you are much more connected to what's going on around you because you're not racing.
Absolutely, and nobody can digest when they are in flight or fight mode. Yeah, so you need to go into this. You know, everything is a sinus wave in life. It's day and night and day and night, and our gut can only digest when we are in rest mode. So what the mindfulness is connected is the movement of our diaphragm. Yeah, and this is where I sometimes see that my patients don't breathe properly because they engage only the intercostal muscles. Yeah,
yes.
And nobody does a deep breath. Yeah, and then I said, let's go into an ad. Yeah, and imagine that you open a window and it smells of fresh air. So,
demonstration.
yeah, and you do literally this. First of all, you stretch your liver meridian, and the second of all, you engage the diaphragm. And when you chew properly, you start engaging the diaphragm, hence it helps with the mindfulness.
That's so interesting, isn't it?
Yeah.
And this is obviously why it's so important to sleep and rest as well, just as another time to allow the body to recover and digest and recuperate.
Absolutely, absolutely. And I always say an afternoon nap is not for losers. Yeah, the biphasic sleep is the healthiest form of sleep that we can think of.
And I was told not long ago that each organ detoxifies at a different hour of the night. Is that correct? Is that something that you practice too?
Yes, so there is something called chronobiology, so where each organ has its prime time where it works best.
Yes.
Yeah, so digestion works best, you know, for some people. I mean, there is no general rule, but it works best late morning, around lunchtime.
Okay.
But what we say in the Chinese medicine, the organ that tidies up after the party, yeah, in the evening during the night is the liver.
And that's where you can sometimes wake up at 3 a.m. and not be able to get back to sleep.
So we imagine that the liver energy flows down like a velvet gown. Yeah, this is how it works well. But what happens when the liver energy goes in the wrong direction? It goes like a pressure cooker.
Yes.
And here is a sort of secret entrance for the liver energy. Yeah?
Yes.
So it depending where your personal weak spot is, yeah, you can have high blood pressure, you can have anger attacks, you can have all kinds of disturbances in your menstruational cycle, you can have sleeping disturbances, and this is when you wake up and you think, oh my god, yeah.
Exactly.
So you need to detox, and that also helps with the fast. Yeah.
Okay. Yeah. And then tell me a bit about biohacking, because I feel like this is a word that is so sort of thrown around now, but actually you have some really innovative therapies and treatments here at Lanserhof at the Arts Club. You have things like the cryotherapy, which everyone has the voucher to come back and use. You have the IV infusions. How are those all helping to regenerate the body and sort of, you know, preserve health in the long run?
Yeah. So biohacking is really a buzzword, or
it's very sexy.
Very sexy.
Yeah.
Exactly. Yeah. And actually, I have always reservations, because life is so hard to us, so why should we hack? Yeah. There are times in life when we have to do this, but life does that at the moment. So let's do that. Yeah. So let's talk about awareness and assessing, and getting a better understanding, because what this is all about, it's building resilience.
Agreed.
Yeah. So building resilience means that first of all you have to know it, and then do something for it, not always against it, because we are so great in finding negative vocabulary. What's wrong with you? This is why I'm sort of when I ask people how do you feel, and I say not too bad.
Yeah, exactly.
What does that mean? Yeah. So
it's not
good?
Awful.
Yeah. Yeah. Right. Okay. So
Even better.
The biohacking. Yeah. So is when you're aware that you need something, we try to help to find the best measure to regulate. So all these measures are helping to regulate your health.
Things like the cryo, things like the IV.
Yes, because it has an impact on the body. So the cryo is great. It feels, for those of you who haven't tried it, it feels like a bottle of champagne under your skin immediately. It's a nice quite shocking, but then you feel like all bubbly and buzzy.
That's true.
Yeah,
you sort of leave on a bit of a high.
Yes.
I'd say.
And the infusions, that goes back to the tailor-made treatments that we do,
because they're very bespoke. They're personalised
we look
to the
at
patient.
what exactly do you need, what exactly do you lack. Now we are in the lacking, because obviously when we do have unhealthy lifestyle choices where we overfeed certain things, the other end we lack the healthy stuff.
Exactly.
So this is where we literally work from both ends, reducing on the one side, and on the other side we help restore health by supplementing from the back. So we have two measurements two measures how we do that. The first is the IV treatments that we do. So we do infusions that we can say are good for everybody.
Yes.
Like we did in the first lockdown, we carried a lot of our patients through with these high dose vitamin C and other nutrients infusions. But we do the tailor-made infusions where we do blood tests first, and then we give them tailor-made infusions. And we do oral supplements. So we work with a company which is called Biohacking, where we take bloods first, and then you get a bespoke supplement. So
that's really interesting.
Yeah. So because we all get tired of taking 7 different things at different times, and then oh my God, I haven't taken it with food, or I've forgotten again.
You're
and
so
then
right.
Okay, next company, and then you throw them all out because they run out. So this company produces a bespoke supplement. It's a granulate that you take twice a day. Yeah. So
you just add it to water, granulate?
Best not, because since it's a granulate, you have it between your teeth, which is quite annoying.
Okay.
So you put it on your tongue and wash it down with water.
Okay,
yeah,
fine.
that's the best thing to do. Yeah, but it's a quite elegant solution. So we take bloods. The company gets a bespoke questionnaire. And then the patient gets the supplement for 3 months, and after 3 months, we then retest and see what else needs to be done.
So you always stay on top of where they are, and that's really clever. And finally, you've got a new program here, haven't you, which I wanted to ask you about, which is your baby. It's called Life, is that right?
Yes.
And what's the sort of philosophy behind it?
So Life is an acronym for the Lanserhof Integrative Fasting Experience, where we... where we came up with a solution in the times when patients cannot travel to our resorts. So we mimic what we do in the resorts just as a walk-in version. So patients would come in every day for either 7, 14 or 21 days and get treatments every day. They get the food in-house.
So you prepare breakfast, lunch and dinner for them. And is it this sort of, the concept that you were talking about earlier, the very plain, like the chewing trainer and the broths?
Yes.
Is that food that you take home? Okay.
Yes, because the reset or the machete that I talked about before is more potent the more monotonous the food is. The least the fewer molecules you expose your gut to, the faster it heals.
That's really interesting. Yeah, people say the body likes repetitive food.
Yeah, and what patients feel, so when you chew properly and thoroughly, you're not hungry. So it sounds, some patients are deterred because they think, ooh, I can't eat, that little. But it's actually quite surprising because the level of satiety kicks in much earlier when you chew properly.
Particularly 30 mouthfuls of anything.
Yeah, and so you automatically don't overeat. And this is then the take-home message,
Yeah, so that you can sort of learn not to have the excess and just...
Absolutely.
Yeah.
And
what are the treatments that you're doing during the day?
So the treatments are deep tissue massage, you get a lymph drainage, you have PT sessions because for some patients it's literally like a kickstart, and to do the proper training you have a body composition MRI where we assess visceral fat, which
all the stuff that gathers around your organs.
Exactly, which is like a translation for how high your cardiovascular disease risk is. You have...
do you do the abdominal massages that you do out in Germany?
Yes, yes, you get that from me.
Very nice. Oh, really?
So every other day patients would see me to assess their fasting level, so we would discuss how it goes, and I would do an abdominal treatment. And the abdominal treatment serves also 3 purposes. It's like a physically moving things along, forgive me, a lymph drainage, and to increase the circulation in the big organs.
And it feels very relaxing, I've always found.
Yes, and it's very interesting. I have a very big respect for that treatment because it's very intimate.
That's true. If
patients
you really
lie
like
there, exposed abdomen, and you just literally stand on top.
Yes.
So it's quite interesting. Yeah.
But there's so much of our immunity that resides in the gut. It sounds like such a great thing to be integrating. So I can
and one of the things that patients notice immediately is the mental clarity that comes. Yeah. First, some suffer from some detox reaction. The further away, or the more unhealthy lifestyle you engaged with before, the more you will probably have a detox reaction for a few days.
Okay, so don't binge eat for like the week before you do this. Try and wean yourself.
No, you get
gently.
Instructions how to prepare.
Okay, that's smart.
Yeah.
How interesting. Well, I would love to try that, as I'm sure everyone here in the room would. But thank you, Dr. Levine. Super interesting. That probably brings us to the the end of tonight's discussion. God, I've been talking too much tonight, haven't I? But I just wanted to firstly thank our amazing panellists, because I think it's been so interesting to hear more about their individual specialisms, and what's so fascinating is to see how they all fit together when we're talking about how to preserve our long-term health. But the other thing that really struck me is how much all of you talk about the sort of link between the physical and the emotional health, and I think that's something that we're all starting to take on board so much more as a result of recent months and years. So good takeaways for all of us, I think. Just before we start an audience Q&A, if anyone has any questions, if you do need to run, we've got amazing goodie bags for you, so please don't forget to pick up one of those on your way out. I think they're just by the door. I think that's it from us. Did anyone have any questions? Please throw your hand up in the air if you do, just so I can see you. Ooh, very quiet room. Yes, Claudia. Yes, please.
So I actually have a question about the effects of blue light on eyes. So I feel like you hear so much at the moment that like watching your screen in a dark room is going to cause your eyesight to degenerate, and that it's just having a massive impact on how we see and how eyes function. I just want to hear your opinion of that and how we can best protect our eyes. But especially, I work at a desk all day, so I'm very conscious of staring at a computer.
Yeah, it's a great question, and it's something that everyone wants to ask after the last 18 months, because that's what we've been doing. There's actually no scientific evidence that blue light damages your eyes. Now, that doesn't mean to say it doesn't damage your eyes, and anecdotally, people who wear blue light protection glasses actually feel much more comfortable, they sleep better, and generally they're able to spend more time using VDUs. But there is a cumulative effect, and up until the last sort of 18 months, when science hadn't really caught up with it, we weren't probably staring at VDUs for that long. Our children were probably, if you had children, our children were probably outside playing much more and not on their computer games. And there is a detrimental effect on spending a lot of time staring at a screen. If you're a child, you're more likely to become short-sighted if you stare at a screen or start reading a lot in a dark room, particularly before the age of 8 when vision's still developing. So it's really important to encourage our kids to go and play as much outside and get good sunlight. But in terms of damage from UV, and Sophie's touched on this as well, and in terms of skin and facial skin damage as well, and eye damage, this is a much more delicate area. So that cumulative effect may actually be more harmful to the eye area. It can dry the eyes more. And there may be a future sort of aftermath of this that we've not yet picked up in terms of the science. So I think you're right to do what you can do for protection.
Was there another question over there? In the red.
I had a question about eye area actually as well.
That's good.
About SPF, because obviously I quite often get told that the skin area is finer, so to use a different cream under the eye.
Yeah.
Should I be using a different SPF under the eye, or is it okay to use
Another great question. So
I've heard more about eye-specific SPFs recently.
Yeah.
It's interesting.
there are more and more companies that are doing eye-specific SPFs. LMD from the States is coming over here. Perhaps they have an eye-specific. I think HelioCare also does. Things that have combination with vitamin C as well, that sort of adds the effective protection. But when we have something on our face, it can travel a centimetre while we sleep up to the eyes. So whatever we put around the eyelids can travel into the eyes and can be harmful to the eyes. So it is important to look for a high protection factor, factor 50 if you can, around the eye area. We see skin cancers. We operate together on patients with skin cancer, and it's the cumulative effect of sunlight, whether that be in a dull light or whether you spend a lot of time outdoors. But people who have been burnt by UVB are more likely to develop skin cancer, and UVA is more the aging. So it's important to use the SPF not just for aging changes, but also for skin cancer protection. And this is an area that we don't really want to be operating on for skin cancer if possible, because it can be tricky to treat.
Should you be taking it right the way up to your lash line?
Should.
Really?
Yeah, if it's an SPF that's specifically made for the periocular area, then you take it right the way up until just underneath the lashes. You can take it off before you go to sleep so it doesn't go into your eye, but you have to use it up to your lashes. Or sunglasses and a hat. So there are simple things
In
you
winter
can
in
do.
London.
All three.
All three.
Yeah, that's true.
Especially if it's midday and you're out
Yes.
on a boat somewhere. So it's like,
It gives me another excuse to go to the hair.
Exactly.
exactly. Always a fashion
So true.
accessory.
Is there another question over there? Yes, lady at the back.
It's regarding after the protocol with fasting, what are the nutrition advice that you give for optimal living?
So on the last day of the fasting, you see the nutritionist, and she will assess all the information that I gave her or the patient gives in this consultation, and then it's individual, yeah. But some patients are quite disappointed because the fast literally weans out, so you're not allowed to, to go full in as you were before, yeah. So there are a few things, and what the fasting does, obviously the longer you do it, you will more feel the effect. In a way, you're more sensitive, yeah. So you're sensitive to smell, you're sensitive to very, like a hot taste, yeah. And there might be some changes that you're aware that your preferences change, yeah, but definitely the sensitivity will change. So I think it's literally a little bit apart from the fact that you start light, yeah, and you don't have any raw food for at least 5 days, yeah.
Why no raw food? Just because you're trying to stop the gut from overworking?
Yes, yeah. So and it has to do with the acidity in the tissue, yeah. So you would then probably try and find, yeah. So it's a trial and error. How your preferences have changed, yeah. But the intense smell and the intense taste might be something you would want to avoid in the first time, yeah.
Hopefully that was helpful. Were there any questions over this side?
Yeah, just out your thoughts on the gua sha and the rollers now, those that was really in, and obviously using it on the face, and specifically in the eyes. Is that something you
Rachna, do you ever use like the gua sha, like the holistic sort of tool from Ayurvedic medicine? Do you ever sort of use that?
Are you talking about like the jade roll?
Yeah,
Or
you have like
the
the rollers
rose
and then the
quartz.
gua shas are like
Yeah,
the sort of
so-
kidney-shaped ones, aren't they?
Okay, so one of the things that Ursula touched on was lymphatic massage, and we have lymph channels in the muscle, the orbicularis, the circular muscle around the eyelid, and that is something that will drain fluid from the eyelid area up towards the ear. So any type of thing that you do to massage the lymph from the inner part to the outer part will help to drain fluid and puffy eyes. And whether you do that with rose quartz or with jade or a roller, or you do it with your fingers, it's effective in the long term if you do that on a regular basis.
You have to do it very lightly though, don't you? They say.
You don't want to be stretching the skin.
Yeah.
You know, so you're achieving lymphatic drainage. So
And
you
there are
don't
some
want to be
really good
stretching the skin.
videos online to watch, like a way to do the whole face, and there's
I always find it very soothing. I guess you've used one yourself, which is why you're asking, but it's so nice to release tension. I mean, do you ever talk to your patients about using it in their regime?
similar lymphatic drain. If I think someone struggles with fluid retention in the face, lymphatic drainage, particularly around the eye.
Yeah.
The one, Hey You, I think, is the one that...
exactly, Katie Brindle's brand.
Exactly. So they do some really nice ones. They do different stones if you like energy properties of crystals and things. And their website has lots of different videos. So that kind of is a
she's
good
brilliant.
place to look.
They just sent me an amazing eye mask entirely made of crystals, which is very
Oh,
soothing.
wow.
Entirely made of quartz, yes.
Ooh.
Actually, you should look into it, Rachna. Eye masks made of
I'd see
quartz.
before and after.
Yes, it's very heavy, actually, when it sits on my face.
Yeah.
Were there any questions on this side? I didn't see. Yes, lady.
What's your stance on the face yoga, and where does that fit in with this high-tech stuff?
I think that's probably a question for you first, Sophie.
I guess my stance on face yoga, things like face gym, your muscles are, of course, part of the structure of your face, but a lot of the time the reason our muscle function changes is actually structural changes to the face that mean the support for the muscles is different. So can they be useful in some patients and in some situations? Yes, it's not going to harm, but the effects are so transient unless you are really religious with keeping it up. And my experience is most people are not the best at sticking to regimes. Discipline comes in here. Most people, unless you are doing these sorts of things really, really regularly and religiously, you will see limited benefit from them. So I'm a big fan of supporting muscle function of the face, but I tend to do it differently.
How would you tend to do it? You talk about your injectables.
Exactly. Usually, for
Or
example,
your devices to lift and tighten.
yeah, but usually, for example, as we age, we notice that our when we're younger, our mouth corners intrinsically turn upwards slightly, and then as we age, they start to turn downwards more. And that's partly because the framework of our face is changing. So as we're younger, our levator muscles that lift our smile are stronger than our downturn ones.
Or depressors, which
Exactly,
is such a good word for them.
Yeah, very. And then as we age, that balance shifts, so our depressors become strong and start to pull more. and our levators become relatively weak, but that's being caused because of the bone loss in our cheeks and our jawbone. And so by using strategic injectables, you can affect how those muscles work. You can make some muscles stronger, some muscles weaker, depending on where you place your filler products, on top of or beneath. So
can I just add to that? Actually, you can do the same with the facial exercises. There are very specific exercises, so you can activate the zygomatics to go up and at the same time.
Is that what you do, the facial yoga?
I incorporate it as well, so I agree that
interesting.
it's good to incorporate some high-tech devices, but at the same time at home, it actually works.
Yeah, agreed. And I think all of you sort of spoke about that. You know, there's a lot of stuff that we do in clinic, but there's also the stuff that we do at home to enhance it, like doing your homework. I think that's the best thing that lockdown showed us, actually, is the fact that you can do this stuff yourselves. Hello? Yes, sorry.
For at-home care, what do you think about LED masks? Is it worth lying under them 20 minutes?
I have friends who swear by them.
depends on the LED mask. So actually a lot of the studies on light are really, really strong, but they're based on not just certain wavelengths, but to do with the strength of the diodes that are emitting them. There are very, very, very few devices on the market that will come close to that at home. I actually say to people, there's a device that's been designed for in-clinic use that's actually really accessible. It's still pricey, but a lot of people I know now are buying those for at home. They're brilliant, but a lot of the ones you'll pick up on random websites, unfortunately, aren't going to come close.
Which are the ones that you can buy for at-home use, which are also used in clinic?
The Dermalux Flex.
Uh-huh.
So the Dermalux Flex is fabulous. So the Dermalux, the Omnilux, I guess, was the original LED. Dermalux is the progression of that. And the Dermalux Flex is like this flexible thing with a clip-in frame. You lie under it for 20 minutes, half an hour. And the results on the Flex are, even the company will say, pretty much the same as the standalone big device that many clinics have. And it's a price point of under 2,000. So it's still an investment, but if you're the sort of, and twice a week, so you're not thinking every day.
And what are the specific benefits?
I wouldn't
depend on the colour of light, doesn't it?
Yeah, depends on the colour of light. So the near infrared, particularly for kind of collagen stimulation, healing, red, kind of anti-aging, blue, acne. I wouldn't really talk about it for lift. Lift is something, I think there are very few devices, I would say, yeah, you're going to see a lift in your skin with that. But a decrease in fine lines and wrinkles, an improvement in your skin texture and tone, a glow, an improved quality to your skin, absolutely. And the good thing is it's safe for anyone.
And those flexible ones as well, they're not just for your face. I mean, you can do them on your back as well, can't you, if you have acne on your back?
Benefit actually with that, and there's a lot of research looking at light with dry eye disease and IPL and LED as well. And so at-home use of blue light can reduce acne, but it can also reduce the overgrowth of the microbiome around the eyes and improve dry eye disease. And so, yeah, we may see
that's
more
really,
of
it feels
that happening.
counterintuitive that staring at LED. What, do you still wear the goggles though?
No, you wouldn't wear the goggles because
Okay.
you want it to act on the little glands, oil glands.
So would you close your eyes?
So
Could it
you
get
close
through the eyes?
It's quite bright,
Uh-huh.
but it can help with dry eye disease.
How interesting. Okay. Are there any more questions? No? I think so. Cool. Well, if that's answered everyone's questions, we'll all be here at the end anyway if you have any more sort of things you want to ask the panel. But yeah, a huge thank you to our beauty triangle. They've been so amazing. I love hearing all of your words of wisdom. And yeah, thank you to you all for coming as well. It's been so nice to see you all in person again. So thrilled we're not doing Zoom webinars now. It's so much nicer to have you all here. And yes, do leave your referral cards if you'd like us to connect you with anyone that you've heard here speak tonight. And yeah, come to our next talk. I would love to see you again. Good night.